As COVID evolves, so does the way we take on the virus. Just this week, Idaho got some technology to help treat people sick with COVID and prevent vulnerable people who can't get vaccinated from getting really sick. Joe Paris got new details on the treatments from Idaho State epidemiologist Dr. Christine Hahn.
The state of Idaho now has access to several new COVID-fighting resources. One, a pill called Paxlovid, is to treat symptoms of the coronavirus when someone starts getting sick with COVID.
We received, I think, 240 doses only, or courses, treatment courses, so not a lot. We're hoping that'll increase a lot because we want that to be medication available for Idahoans who come down with COVID.
State epidemiologist Dr. Christine Hahn says that Idaho just got the new pill this week. Another pill like it is expected to arrive soon. But because doses are limited, for now, so are the people who will get it.
Similarly to the monoclonal antibodies, Paxlovid will be reserved for people who are at high risk for getting severe disease or getting hospitalized with COVID.
Dr. Hahn says the pill will be available by prescription only, but there is hope that more doses of the medicine will soon be available to Idaho. There's been recent concerns about the use of monoclonal antibodies to fight off the Omicron variant. Monoclonal antibodies work by attaching to the virus and prevent the virus from infecting cells. However, the treatment only works if a person gets COVID or if they are immunocompromised and exposed to the virus. New research shows that only one of the 3 monoclonal treatments available in the United States are really effective against Omicron. Dr. Hahn says because of that, Idaho will only be allowed to order the one effective monoclonal antibody treatment going forward.
We're very discouraged to say we expect a drop in overall availability. The sotrovimab, which is the one that we'll still have, is available to us again only in very small numbers. We're taking everything we can get, making sure it's getting out to those monoclonal treatment sites. But we know that overall there will be a drop in availability.
Because the other 2 treatments are not effective against Omicron and there's no quick way to find out what variant a patient needs treatment for, the United States is transitioning to the one treatment that is effective against the Omicron variant. Like the new antiviral pill we just talked about, Idaho in all states has limited access to this new medicine.
We do have some, not very much yet, but we are continuing to order. We'll be ordering some more this week. Everything the federal government lets us order, we are ordering.
The Department of Health and Welfare is asking providers to be thoughtful and reserve the treatment to patients with the highest risk. Another new piece of medicine now in Idaho is also to treat those who are most at risk with COVID. It's called Evusheld, and it's made to protect vulnerable people whose immune systems are unlikely to respond well to a COVID vaccine, like someone who's immunocompromised or someone in delicate health, like a cancer patient.
These antibodies will protect them from getting sick with COVID for at least 6 months and possibly longer. So this is a wonderful product that we're very excited to start having distributed to Idaho patients with cancer, patients who are transplant or have other severe immunodeficiencies.
Like the other new treatments, Idaho has limited access for now to Evusheld, but Dr. Hahn says that the treatment is really encouraging for those that have been waiting for it for months.
The availability of Evusheld as a way to protect people with severe immune compromise, who we know, even if they're vaccinated, have had to been so worried. And we are hoping that this offers real security for those folks.